The Mental Health Research Initiative funds collaborations across sectors, disciplines and regions, with the aim of facilitating interdisciplinary working to address mental health research needs.
When you're researching mental health, it's a real human science, and you just can't look at it from one perspective. You have to understand the whole human. In my field, in suicide research, collaboration is essential because to a patient, their suicidal thoughts and the distress that they're experiencing arises because of a whole array of social, interpersonal, cognitive aspects of their lives that really, really trouble them. It's just not one individual factor which is driving their suicidal distress. So if you're only interested in, let's say, loneliness, you just won't understand how their loneliness relates to their finances, their employment situation, the aspirations they always had throughout their life that they've never quite reached. And unless you look at loneliness in the context of all these other factors, you don't really get a full picture of why they're feeling suicidal and how you might help them to feel less distressed about their situation and less entrapped.
Many funders seek in their awards the integration of people from multiple disciplines. I think intellectually people appreciate that is a kind of stimulating area to be in, working with people from different disciplines. Many senior researchers are now, as well as training in their original discipline, are now seeking to develop expertise across a range. I think it will yield better and more insightful research and new ideas.
The MHRI supports partnerships between researchers, clinicians, patients and local communities. So how can we work together and design research which is helpful to both service users and policymakers?
We've worked with 50 plus universities, and what has been crucial is right from the outset, seeking that willingness and commitment to genuine collaboration and co-production. We're beginning to see a lot more involvement from partners asking us to be involved from the project idea or proposal or the research development phase, which is brilliant. And then also the elephant in the room is ensuring that organizations are well reimbursed for their time, because not many charities will have huge funding pots.
We worked with Trust Links in recruiting public contributors and service users to really think about how we can shape the research and the programs that we deliver, and that's been really successful. So I think my biggest suggestion will be working with existing local community groups to then scaling up.
And I also think that in research, there should be a lot more partnering with policymakers. We have our young activists, we have our youth voice to really start to talk to policymakers about how research can be embedded in their decision making.
Where there was really genuine cross-disciplinary collaboration, it did take time for people to establish a language and shared way of working, because we often are coming from quite different perspectives. So I think it's really important that funders sort of push the issue, but also allow for a bit of flexibility in terms of timing to let people develop their relationships, develop their ways of communicating and ways of working together.
The NIHR 3 Schools Mental Health Programme has supported over 80 awards working collaboratively across primary care, social care and public health. Find out more about MHRI collaborations by visiting our website.